Hello everyone, I'm Dr. Vignesh J. I'm a ENT and a head and neck oncosurgeon. I also subspecialize in snoring and sleep apnea surgeries. Today I'll be talking to you about one of the most common symptom a patient presents to me in the clinic is sinusitis. Most of the patients who present to me in a clinic, what are the symptoms they present with, or what are the symptoms you have to look out for? If you have these symptoms, it's better to get it checked. So one, the most common symptom they present with is headache. But is headache the only cause of sinusitis? No. There might be other causes of headache. Heaviness in the head, yes. One of the main causes we need to rule out is sinusitis. So what are the other symptoms apart from headache? One, nasal secretions, where you have either a whitish secretions or a yellowish secretions or a greenish secretions coming from the nose. It could be in the form of a nasal block. It can be one-sided or both sides. Or patient can present with the mouth breathing because their nose is blocked, or they can present with foul smelling discharge from the nose, or they can also have decreased perception of smell and taste. Because the nose is blocked, they may not be able to perceive the smell or taste. Are there any other danger symptoms of sinusitis? Yes. If the patient is having any decreased vision, or if along with their nasal symptoms, if they have any double vision, that is an emergency, because that means the sinus infection has spread to the neighboring eye structures. And if they have any nasal bleeding along with their nasal discharge, then it's very important to rule out other conditions like malignancies and invasive fungal infections, which can present that way. So what are the other danger signs apart from the nasal secretions, nasal block, heaviness in the head? Will be your ear symptoms. Some of the patients can present with recurrent ear pain, ear block sensation, because these infections from the nose can spread to the ear through a tube known as eustachian tube. It's the same phenomenon when it happens when you happen to travel during a flight, or when you go to a hill station, you experience a ear block. That's because there is a tube which connects our nose to the ear, known as eustachian tube, through which this infections from the nose can spread to your ear, causing acute suppurative otitis media or blockage in your ear. So what are the medical management and what are the options? So when you present to us with an acute viral infection or a bacterial infections, there are symptomatic treatments which we initiate with based on the findings what we see. So if it is a viral infection, generally we don't require an antibiotic, contrary to the norm what many physicians prescribe, or even other physicians do end up prescribing antibiotics for viral infection, which is usually not required. Just a symptomatic painkiller or a symptomatic decongestion nasal drops or a tablet will do for them. That's why a physical examination rather than self-medication is important. So if it is a bacterial infection, so we look for these signs during our examination, where we might also do a nasal endoscopy to confirm our findings inside. Once the examination findings are confirmatory of a bacterial infection, patient might require an antibiotic course along with a decongestant, along with the nasal sprays and nasal wash to get out the secretions from the sinus cavity and also treat the underlying infections. So do we prescribe tests for these people? Depends again on the symptoms. If the symptoms are persisting for more than a week, 2 months or years, definitely they will require other investigations to rule out the cause of infection rather than just treating an infection. Sometimes we want to know what caused this infection. We want to see whether it's a virus or a bacteria or a fungus, or is there any anatomical structure which is blocking their sinuses. To know more detail about these information, we might order a CT scan of your paranasal sinuses to see how your sinuses are, whether they are blocked, whether the entrance to your sinuses are blocked, whether there is any evidence of osteomyelitis, is there any evidence of fungal growth in your sinuses, or is there any anatomical or structural blockage which is causing your sinus not to drain normally. Along with a CT scan, we might order a blood investigation to rule out any allergies or undergoing infections. So when it comes to treatment, so we have done a CT scan, we have done an endoscopy. So what are the treatment options now? When it comes to treatment, again, medical management is there and the surgical management is there. Not all patients require surgery, and not all patients will be fit only for medicines. Sometimes we need both medicine and surgery. So based on your endoscopy finding, based on your symptoms, based on the findings on your CT scan, we decide whether this patient requires only medicine or whether this patient requires only surgery or a combination of both medicine and surgery. So when it comes to medicine, patient based on their infection, whether it's a bacterial infection, might require an antibiotic. If it's a viral infection, again, only a symptomatic treatment of painkillers and a decongestant and a proper nasal washing will do. When it comes to bacterial infection, patient might require an antibiotic course, a nasal wash, and a prolonged use of nasal decongestion with a steroid spray. When it comes to fungal infections, patient along with their fungal infection with a nasal polyp, patient also will require a short course of steroids to decrease the size of their polyps and to open up their sinus openings. If there is a lot of polyps blocking your ostia, not responding to a medical management, patient then will require these endoscopic sinus surgeries, which nowadays have advanced a lot, and these are minimally invasive surgeries. You won't have any scars, any marks on your outside. It is all done through via endoscopes and with the help of new gadgets like microdebrider, cobblator, where the pain when compared to conventional techniques are much lesser, and most of these procedures are day care procedures when you will be operated in the morning and probably discharged by evening or the next day. So what precautions can you take to prevent sinus infections? One, when you're traveling to a dusty place, you can wear a mask to prevent the amount of dust which enters your nose. And post, say if you have worked in a dusty environment or if you've gone to a dusty environment, once you're back, you can do a nasal wash. So in further videos, I'll be teaching you about how to do a nasal wash. Other medication you might require, as I informed earlier, will be a steroid nasal spray depending upon the condition. Please don't self-medicate because these contain medicines, and medicines when abused can cause side effects and complications. So please don't self-medicate. The only thing you can do as of now is do a nasal wash, which is safe enough. Anyone can do to prevent any sinus infections. These are very similar to gel niti, which our ancestors used to do. Gel niti is nothing, a neti pot where we wash our sinuses. It's like having a bath for your sinus. Basically, washing out all the dirt and other dust which is settled down, and it also improves your mucus clearance from your sinuses. So, what are the outcomes of surgery? So, you have undergone a procedure. Is it too painful? No. Previously, when conventional techniques, yes, there might have been a lot of pain associated with these surgeries, but with this new advanced technologies like coblation, the pain is very minimal. That usually will be there for the first 1 or 2 days. Once the procedure is done, and you probably will have to visit for one sitting for a nasal cleaning, followed by a nasal wash. Post that, it is literally pain-free. If you require any other information regarding your sinusitis, or if you're already suffering from sinusitis or nasal polyps, please do visit us so that we can clarify, do a proper examination and guide you through what you require. Because ENT, unlike other branches in medicine or surgery, it's all inside cavities which requires examination via an endoscope or a microscope to see our ears. So it's imperative that you get checked by a physician rather than assuming what it could be and self-medicating and harming yourself. Thank you.